This is the case of a 20-year-old girl with a type 5 AC joint dislocation following a motorbike injury. These are the ports. You can see the anterior viewing port just off the anterior corner of the acromion and the working port of the coracoid process. You can see this is the coracoid process that is being prepared, and once that's done, attention is then turned to the superior acromion. You can see that's the distal end of the clavicle that's being pushed down. You can see the clavicle reduces with reduction of the AC joint, and that anatomical AC joint reduction can be confirmed visually. Now, using the Arthrex aiming guide, the tunnel between the clavicle and the coracoid is made. This is the drill bit coming through to the aiming guide on the undersurface of the coracoid. The drill bit is hollow, and once the internal cannula is removed, the nitinol wire can be passed and retrieved with a grasper from the undersurface of the coracoid process. Once that's done, the ABS titropes can then be passed with a leading suture. Here they're being passed through the nitinol wire, and the nitinol wire is then used to pull the leading suture through, which you can see there coming through the coracoid process, and then the ABS titropes come through. Because the dog bones clip onto the sutures separately, and they don't have to be taken through the bone tunnel can be kept at a 3mm diameter, which is quite small and avoids the risk of coracoid fracture. You can see here the dog bone on the undersurface of the coracoid process being placed into position so it sits nicely. And once that's done, attention is turned to positioning the dog bone on the superior aspect of the clavicle. You can see here we're clipping the dog bone onto the ABS titropes. This can be done because it's got slots in it that allow the sutures to engage. Here's a close-up of the dog bone on the ABS titropes. The ABS titropes must be marked before being passed so you know which is which. The dog bone is then parachuted down into position and passed through the small incision on the dorsal aspect of the clavicle. And this is looking across the top of the acromion at the distal end of the clavicle, and the reduction can be confirmed as the ABS titrope is tightened. You can see here it's being cinched down, and as it does, the clavicle reduces and the AC joint reduces, and this is confirmed visually. Once that's done, two Q-fix anchors are then placed adjacent to the AC joint in the acromion. The suture anchors can be placed within the thin acromion, and they don't need to protrude on the undersurface. Here the sutures then fixed into the distal clavicle with bar and knotless anchors. This is the first of the bar and knotless anchors going in, and that takes 4 sutures across in a tightrope tight configuration. Once the first one is in position as such, the second one can then be introduced and placed, and that completes the fixation of the AC joint reconstruction. So you now have 8 sutures going across the dorsal aspect of the AC joint, reconstructing those dorsal superior posterior ligaments of the AC joint. Once that's done, all those sutures can be cut. There are no knots tied, and there are no knots sitting across the top of the acromion or clavicle. You can see here the AC joint reconstruction, and in the distance you can see the coracoclavicular ligament reconstruction with the dog bone sitting in place. Just again, the AC joint reconstruction, and in the distance medially you can see the dog bone on the superior aspect of the clavicle with its sutures cut and no knot there. You can see now these are the post-reduction x-rays, and you can see a nice reduction with the 2 dog bones sitting, one above the clavicle and one under the coracoid process.